Hi, welcome back. This lecture is going to be on prevention, medical histories, and vital signs. We talked briefly in the last lecture about medical histories. They are very important. So the first thing that you're going to do is review their medical history and update it every single time they come in. It's going to include not only prescription drugs, what are you taking, but you're also going to ask, what are they taking over the counter? What are their vitamins, minerals? What are they taking? Sometimes you have to ask little other questions. You may look on it and say, oh, I see that you have arthritis. Are you taking anything for that? Oh, just a baby aspirin. Not a big deal. It's just a baby aspirin. But an aspirin is a blood thinner, so that plays in if there's any kind of extractions. So all these things are important. Medical history, of course, is confidential. The patient must sign a consent saying you can share this with a family member or another dental office you might refer them out to, or their insurance company. And of course, that consent form comes under HIPAA. HIPAA, you all know about HIPAA. It's been around since 1996. And this started off mainly with insurance companies, like, can I know this information that the doctor is doing, and since then it's become bigger than that. HIPAA now is like you have to be careful that other patients don't see the information that this patient is. Everything is very, very confidential, and you have to protect the patient's rights. This is a picture of allergies. This young child is having an allergic reaction to something. All those allergies must be recorded, because if a person has lists, I'm allergic to this, this, and that, then they may very well be allergic to something in the dental office. And common dental office allergies are to latex, found in the gloves and in dental dams, and antibiotics. A lot of people are allergic to penicillin, pain medications, or local anesthesia. They might also be allergic to the metals, such like in the amalgam, or any other. If they have any other allergies, such as food allergies or pollen, then again, they may also be allergic to something in the dental office. Medical alerts. Sometimes you will highlight in their health history, you're going to highlight everything that they're allergic to and all their medical conditions. And we used to put the stickers on the outside of the chart so you saw it right off the bat. Now, because of HIPAA, you can't do that. All this stuff has to be hidden inside the chart. And of course, I'm talking paper charts. Most offices now are going to a digital chart, so there'll be different alerts with that. Clinical observation. When you're seeing the patient, observe, watch them. What's their skin tone like? How's their walk? What's their speech like? What's their emotion like? If you have somebody that's really, really hyper, they're ones that may faint on you. That they're starting to hyperventilate, that they're so nervous. So you want to watch this. The other thing that you want to watch for are people who are under the influence of drugs or alcohol. You cannot work on somebody under the influence of drug and alcohol. And this is common because people get nervous. They think they're going to have a little shot before they go in. But if you're giving anesthesia or different things, you don't know what they took. You just know that they're not right. And so you don't know what the interaction might be between the drugs and what you're doing. And the other thing is, they can come back and say, I didn't consent to any of this work. I was under the influence. So you cannot work. And sometimes you even have to call the police. Pregnant patients. You have to ask a patient before any procedure, but especially x-rays, is there any chance you're pregnant? And you really have to ask as young as 13 in today's world. Vital signs. Vital signs are your blood pressure, your pulse, the respiratory rate, and your temperature. And you're going to have clinical experience in this when you come into school again, and you'll go over this with your instructor. The blood pressure. The blood pressure is the pressure that the blood places on the walls of the artery. Hypertension, which is high blood pressure, happens when there's too much pressure on the arteries, and this can result in a stroke or a heart attack. There's a really good video in this lesson that you will watch next, and it'll show this in a very simple 3-minute video, but it talks about how the plaque builds up. You have a small little artery, and it gets smaller and smaller if you've got plaque and cholesterol built up there, and so when the blood's going through it, it builds more pressure on that wall, and that's how you get high blood pressure. There's two readings, the top one and the bottom one. You'll say 120/80. So what's the top one? That's the systolic pressure, and this is the pressure on the arteries when the heart is beating. The second one is the measurement of the pressure of the arteries when the heart is relaxed between beats. The pulse. The expansion and contraction of an artery caused by the ejection of the blood from the left ventricle of the heart as it contracts. This is most commonly you're going to take it down by the wrist, and you're never going to take it with your thumb, but you're going to learn all this and just exactly how to take it. You can also take it at the carotid artery, which is up in the neck, but that's a little trickier with a patient, you know, so it's a lot easier just to hold their wrist and take it with your 2 fingers. The pulse is counted for 30 seconds and then multiplied by 2. This is your respiration rate. This is how fast you're breathing. Are you breathing, you're hyperventilating, or you're breathing normally? Normal is between 12 and 20 per minute. And so when you're going to do this, you want the patient just breathing normally. So what you're going to do is pretend that you're still taking their pulse, but you're just really watching them breathe, and you're timing it, or you're still doing their blood pressure, or you're talking to them about something else. Because if you say, I'm now going to watch you breathe, you will not get an accurate reading. Temperature. Oral thermometer is recommended. They do also have digital thermometers now, which are also very, very accurate in today's world. And why would you take that in the dental office? If the patient is ill, I don't really feel good, but I wanted to keep the appointment. Let's find out. Or if they have an infection. If a patient has a temperature and they're not sick, okay, of course this is the doctor's call, it's not your call, but just so you know, the patient comes in, they have a face that's swollen, they have a toothache. The doctor may take their temperature to see what it is. Now, if they have a temperature in it, then that means that that infection is not just right there in the tooth, it's now gone systemic. And so it means it's now going through the body. So chances are the doctor will not extract that tooth, because that's right then and there. They'll put them on an antibiotic first, because that can be dangerous. Vital signs techniques. So when you come in, that your instructors will go over all of this, how to do it. You'll practice on one another, and then there will be a competency at the end. Thank you very much.